Missouri is finally moving forward on establishing a prescription drug monitoring program. Good evening, I'm Bob Cervera. The state Senate passed legislation for the program this week, and while there's a high level of support for it locally, a person at the forefront of the Fight Against Drug Abuse organization shares a warning. KQ2's Ron Johnson now with more.
It was music to the ears of many fighting against drug abuse here in St. Joseph.
It's honestly some of the best news that we've gotten in a while.
The state's movement towards starting a statewide prescription drug monitoring program, they say, is a major step in the fight against drug and, more specifically, opioid abuse.
We're way behind. It should have been done a long time ago.
Missouri has been the only U.S. state without a program at the state level for nearly the past decade, though there have been attempts to spread smaller programs across the Show Me State. One from St. Louis was brought here over 3 years ago and has proven effective.
We've definitely had a much easier time catching patients who need an intervention from their provider sooner.
But those programs don't cover the whole state, and as attention towards a potential statewide program grows, one local man very close to the issue says there could be a negative impact at first.
It's going to force doctors as well as pharmacies to stop giving these prescriptions. So you're going to have people that are addicted to these prescriptions that are going to turn to the street. Just because you take it away doesn't mean that they're going to stop.
For Mark Puckett of the St. Colby Puckett Center for Healing, the push to get drugs off the street is personal. Puckett lost his son to a drug overdose and says the best way to combat the issue is with a detox center.
If you do an inpatient where you can hold them there until they can get into a treatment center, that's going to save lives.
His sense of urgency fueled by personal experience and by seeing case after case in town where someone dies of a drug overdose.
You know, that's somebody's child. It's somebody's family member, and we've got to attack this issue head on. We got to quit hiding under the sheets and saying, well, this isn't happening, because it is happening.
Ron Johnson, KQ2 News.
Thanks, Ron. The previous drug monitoring program from St. Louis was expanded to cover as much as 85% of the state. The new statewide program would replace it.